Hi friends, I am Dr. Ashutosh Gupta. I am a consultant in fetal medicine. So today we are going to talk about an entity called as a neuroarthrogryposis. So as you know that the baby remains into a pool of water which is called as an amniotic fluid, right? So the movement of the baby is very imperative and it is very important because baby in toto grows by 1 millimeter every day. So meaning thereby that the underlying skeletal system, bone, overlying muscle, subcutaneous tissue, nerves, and then the arteries and the veins, they have to grow simultaneously. So if any of the element doesn't grows, or if the baby is not able to move for more than 3 weeks, and then we can have an arthrogryposis. So this arthrogryposis can happen because of the nerves, because of the bones, or because of the skeletal system. So neuroarthrogryposis can happen, right? And this is very important for the baby to roam around and to move at every joint. So this is one case of a neuroarthrogryposis that I'll show you now. This is one case in which so this is a DADC twin. So one of the baby is having this hyperextended both the knee joint, right? Okay, so meaning thereby that the extension of the knee joint is greater than 180 degrees. So it is something around 220 or 230 degrees. So they are hyperextended knee joints at both the knees, and then you do have a rocker bottom feet which is called as a Persian slipper. So you can identify that the feet are also abnormal position. So the baby is not able to move at an isolated movements at the knee as well as at the ankle. So the baby is moving en masse. So we have looked around it after some time. So meaning thereby that we are very specific about the finding, and we have given the benefit of doubt for the baby to roam around. And so what we have identified is this, that the baby is really stuck up into this same position over a period of time. So we are dealing with a condition called as a neuroarthrogryposis. So this condition of a neuroarthrogryposis is very heterogeneous. It can have genetic, it can have anatomical, it can have other etiologies involved. But the baseline is this, that once the baby is not able to move, and so the baby can have because of the movement, the baby needs the movement because of the passage of the amniotic fluid that the baby swallows. Okay, so we can have a nuchal edema, you can have an hydrops, you can have a polyhydramnios, you have delayed gastric filling, and we can have an intrauterine growth restriction, pulmonary hypoplasia, and a lot of other complications. But this is how the neuroarthrogryposis usually presents. So abnormal position of the joints, and then the baby is moving, is not able to move those isolated joints, and then baby moves en masse, right? So this is how the neuroarthrogryposis looks like. So there are a lot of things to talk about, and but this is what, so they might need some further counseling and investigations so as to identify the well-being of the baby, and slightly difficult to sort of counsel the patients as a matter of fact. Thank you very much for your patient listening.